Hi everyone, myself Dr. Vinoth. Today we will discuss about irritable bowel syndrome. Many of you might be familiar about this term, but few of you might find it very new. But if I mention some of the common clinical scenarios of how the patient present to the OPD, you will definitely correlate with this problem. First scenario, whenever the patient takes food from hotel, that too spicy foods, he will experience increase in frequency of stools with or without abdominal pain. Second scenario, whenever the patient takes milk and milk products, they will have typically increase in frequency of stools. Third scenario, whenever patient takes carbonated drinks as well as alcohol, that too typically beer and wine, patient have increased bloating sensation or increased burps around 50 to 60 burps per day, then have stomach fullness with or without abdominal pain. Fourth scenario, patient has difficulty in passing stools. That too patient typically complains that it will take 10 to 15 minutes for defecation alone, and until or unless they take some hot water, hot chai or some stool softeners, then only they will have the relief of symptoms. Final scenario, patient after taking their meal within 1 to 2 hours they have increased abdominal pain. Only after passing of the stools they will have relief of symptoms. If you have experienced these typical scenarios in your lifetime, there is a possibility that you might have irritable bowel syndrome. What is the actual problem in irritable bowel syndrome? There is no structural abnormality in the intestine, but in patients with IBS, their intestine becomes more reactive, particularly to certain foodstuffs as well as during certain emotional conditions. So this overreactive intestinal smooth muscle will be contracting and relaxing on their own without proper signaling from our brain. So because of this, patient experience abdominal pain as well as altered bowel habits. Patient might have diarrhea or constipation, or alternating between the symptoms of diarrhea followed by constipation. Since there is no structural abnormality, only the abnormality is functional, whatever the investigation we do, that might be negative. We do MRI scan, contrast CT scan, colonoscopy, upper GI scopy or stool testing, everything will be coming out negative. So the diagnosis is mainly based on the clinical symptoms as well as ruling out of the other conditions with the similar symptoms. The intestine overreacts in irritable bowel syndrome. Each and every individual has difference in appearance as well as behavior. Similar to that, gut behavior also differs in each and every individual. Take an example of our friend circle. Some of our friends, even after we tease them, they might be moving so cool. On the contrast, some people will be throwing up tantrums even for some petty issues. Similar to that, some people who are genetically predisposed to irritable bowel syndrome, even taking some small quantity of certain foodstuffs or during some certain emotional conditions, that will be triggering the overreaction or increased activity of the intestine, which make them prone for irritable bowel syndrome like symptoms. Now we will move on to causes of irritable bowel syndrome. There are multiple theories proposed regarding the causes of irritable bowel syndrome. We will discuss few of the common causes. First thing is GI motor abnormalities. So the gastrointestinal tract will be pushing the food we consume for digestion throughout their length in two types of movements. First type of movement is called peristalsis. Second movement is called as segmentation. Here the total intestinal length is divided into 50 plus different segments, and this each segment will be pushing the food in a different manner. So each different segment will be acting independently and they will be pushing the foods along with taking the assimilation. So they will be absorbing the nutrients from the foods we consume. On the same time they will be pushing the food after particular time. So if there is any incoordination between moving the food from one segment to the other segment, it may present with IBS like symptoms like diarrhea or constipation. Next cause, CNS dysregulation. As I already mentioned, there are multiple segments in our intestine that will be acting together, coordinating with each segment. So each segment has their own nerve supply as well as blood supply. So the signal has to come from our central nervous system, typically our brain, through multiple nerves that will be reaching the segments. So the signals will be carried through these nerves. This is called as brain gut axis. If there is any abnormality in this pathway, then one part of the intestinal segment will be overreacting and on the other part that will be less acting. So this might result in irritable bowel syndrome like symptoms. Third cause, psychiatric illness. Psychiatric problem as well as irritable bowel syndrome are so much correlated because in patients diagnosed with irritable bowel syndrome, nearly 90% of the patient had any one of the psychiatric problem in their past. But no one disease is typically predominant in irritable bowel syndrome. So what is the problem here? Because patients with any psychiatric illness, they are more prone for sleep deprivation, improper diet habits, which make their intestine more reactive or overreactive. As well as once the patient is diagnosed with irritable bowel syndrome, it gives them further emotional stress that further increases the symptoms of irritable bowel syndrome in a cascade manner. Coming to the next cause, post-infectious irritable bowel syndrome. This is one of the common cause for formation of irritable bowel syndrome in young patients. Due to repeated infection with intestinal bacteria as well as parasites, the intestinal mucosa will be inflamed. So this inflamed intestinal mucosa make the intestine more reactive even to certain foodstuffs as well as emotional conditions. Typically, the infection with Campylobacter bacteria, E. coli, Salmonella and Shigella make the intestine more inflamed. So the duration of the illness as well as the bacteria which is causing the infection as well as the what is the actual content of the good bacteria in the intestine as well as the genetics of the patient will determine the future formation of irritable bowel syndrome. Now coming to the final cause, dysbiosis, are also called as altered microbial flora. I will say this is one of the most important cause because normally in our gut, that too in our large intestine, there are multiple microbial flora or bacteria in them. So these bacteria are generally beneficial as well as some bacteria are harmful, but generally these beneficial bacteria are more in number, so that will be overcoming these harmful bacteria. But if this equilibrium is disturbed due to certain foodstuffs or sometimes you are taking for long-term antibiotics, both the bacteria will be affected. So once the harmful bacteria increase in number, they make the gut more prone for this inflammation, finally overreaction of the gut. So in patients with irritable bowel syndrome, one study concluded that in patients with IBS, their gut analysis reveals that there is increase in the number of bacteria from bacteroids as well as Enterobacteriaceae family, which are inflammatory in their purpose, which means they are harmful bacteria that are increased in patients with IBS, which make the gut more overreactive. On the other hand, there is decrease in the number of the bacteria like bifidobacterium as well as Faecalibacteria, which are actually anti-inflammatory as well as beneficial. So this concludes that this dysbiosis is also one of the cause for irritable bowel syndrome. This marks the end of part 1 of this video. In the second part, we will discuss about how to diagnose the irritable bowel syndrome as well as the symptoms of irritable bowel syndrome. In part 3, we will discuss about the low FODMAP diet, which is one of the commonly prescribed diet plan for irritable bowel syndrome. If you find this video useful, do like and share and subscribe to Dr. Vinoth's Medi360 channel. Thank you.